Welcome into Body and Soul right here on 938 Live. Thank you for joining me, Daniel Martin, for your daily health check. Nasal congestion. Now, many people are of the opinion that a nose gets congested or stuffy from too much thick mucus. That's not exactly true. A congested nose happens when the membranes lining the nose become swollen from inflamed blood vessels. Now, this swelling makes it hard to breathe because it blocks the normal flow of air. Congestion can be caused by many of the same things that cause a runny nose, including colds, allergies, sinus infections, and the flu. Nasal congestion can cause minor problems such as a dry mouth and even a sore nose, and even more serious issues such as problems with hearing. Now, the most bothersome problem associated with nasal congestion, of course, is that it can interfere with your ability to get a good night's sleep, and that in itself can have serious consequences. How then can you seek relief and respite from nasal congestion? We're speaking today to Dr. Leong Lin. He's a consultant ENT surgeon from Singapore General Hospital. Dr. Leong, hello. Welcome back to the program. It's good to have you here with us again today.
Thanks for having me.
Let's start off a little bit with understanding nasal congestion itself. I talked about, the membrane issues. That's what's swelling up. That's what's causing it. Tell us a little bit in more layman terms, what's really happening to cause this nasal congestion?
There are many causes of swelling in the nose, and the lining nasal swelling can be due to inflammation or infection. And commonly, all of us who have a flu before, you have nasal congestion. That's because of the virus infection, and then you have the swelling of the lining. So it actually decreases the air space that the nose has.
Because of the swelling of these membranes.
Yes.
Right.
Yes. And therefore, the amount of air that can actually go through the air passages is reduced. Now, if you have a nose, the septum that's deviated, or turbinates that are actually unusually large, then again, it's easier for a person like that to have a blocked nose compared to someone who has a straight septum.
So how does it manifest, this nasal congestion? I mean, so many of us associate it with, the runny nose, the sniffing all the time. Is that what's happening with the nasal congestion issue?
Yes, it's part and parcel of any disease, like maybe allergic rhinitis, sinusitis, or even just a flu. So what happens is you have the four main symptoms of the nose: the blockage, runny nose, sneezing, and itching. So all those are manifestation of the underlying inflammation.
So how common is this instance? I mean, how common does it occur for us Singaporeans? I mean, we get flus all the time, unfortunately.
Yes, I think majority of the people actually has some form of nasal blockage.
Yeah.
Now, most of the people would have grown up with a nasal blockage, unless you have breathed normally through your nostrils before. If not, you will never know how it is like. So a lot of times people don't even know that they have nasal blockages.
What happens if it is occurring on a regular basis? Does this indicate some people say they wake up every morning with a nasal congestion. Mm-hmm. It's not that, in that case, I don't think it's really due to a common cold or a flu in that sense.
No, that's more likely due to allergies.
Yeah.
That's probably the most common cause. And allergies are the number one cause giving that kind of symptoms. Now, a lot of times make the patients actually feel very troubled. They're not able to concentrate. They're not able to sleep well because of the blockages.
And it gets worse when you lie down, doesn't it?
It actually does. In fact, when patients sleep, they actually have to lie on one side and then shift to the other in order to relieve the congestion. It's gravity dependent.
Right.
So if you lie on the left side, and then the mucus sort of swell up more on the left side.
Okay.
So a person who has, let's say, on the right side that is congested, they actually would try to lie on the left side so that the right side is left blocked in order to sleep better. So if you don't sleep well, basically the next day you don't feel well, you're not able to concentrate on your work, you can't perform at 100%.
Yeah. Could this be linked also to other issues like snoring or sleep apnea issues?
Yes, some people do have sleep apnea that can be due to nasal blockages. I would say that if it's just due to nasal blockages itself, probably the mild snoring problems. I think the deeper ones, nasal blockages are not the only site of the blockage. Probably the tonsils or even the tongue base that's responsible for the severe sleep apnea. But for the plain snorers, a lot of times the nose are a huge issue.
Right. So if the swelling is occurring on a regular basis in the membranes, it could be for the regular snorers, that could be the cause.
Yes.
Right. Well, tell me a little bit also about who it occurs to. I mean, almost all of us have had a common flu or a sniffle here and there. Does that mean we're all susceptible towards this happening?
Yes. The blocked nose is a very common symptom.
Yeah.
Not only allergies, people with sinusitis and certain conditions like even pregnant ladies, because of the hormonal change, they can also experience increase in the nasal congestion during the term of the pregnancy. So these are the people that can actually, the only time they get relief is after they deliver the child.
And you mentioned earlier as well, so many of us have grown up with nasal congestion, and we get used to it,
yes,
unfortunately. Is that dangerous, though, if you don't treat it, if you don't seek out treatment for it?
Well, this is, it's not going to kill you, but it will impact upon the quality of life for sure. In terms of the productivity of your work, how you come across working, or even in students, actually, the performance at school can be affected, and you need to understand that a good night's sleep or to get rid of the nasal congestion will make the difference.
Right. Well, like you said, I mean, school kids can
Yes.
be affected by this. Anybody can be affected by this. I've also read that it can be particularly serious for infants, because even though nasal congestion is just an annoyance for most older children and adults, babies who congested in the first months of life, they can have trouble nursing after that, and it can be very deleterious in terms of their sleeping as well, because they can't breathe through their mouth, apparently.
Yes, because infants actually are obligate nasal breathers, which means if you were to stop with the nose, they actually do not know how to breathe. They actually turn blue. So
what we're doing is, if we have a nasal congestion, we start breathing through our mouth. That's natural reflex for us.
that is natural.
Okay.
There are some cases where people actually think it's normal to breathe through their mouth.
But for a baby, it's not.
It's not.
So that could obviously lead to a fatal issue.
Yes, so it does affect their feeding. So they need to, they're struggling to breathe, and there you are, that's the number one thing. So they will not be able to feed well if they can't breathe well.
So for an infant, how would a parent recognize these symptoms?
Well, most of the time when the infant has nasal congestion, you can see a lot of mucus, more like flu-like symptoms. And you can see that they're quite irritable. Basically, they can't sleep as well. So being parents, I think you'll be kept up the whole night.
In terms of getting medical attention for the average person who may be experiencing nasal congestion, when is a good time to start thinking about consulting a medical professional?
If a nasal congestion that refuses to go away by 2 weeks, I think it should be and of course it occurs on most days of the week. It's about time that you should think about consulting someone, maybe a GP to start off with, before you see a specialist.
What do you expect to encounter during these consultations? Is it about getting to the root cause of why this is happening? So first step, would it be an allergy test?
No, a lot of times, if you were to see a family practitioner, what they will do, they give you some medication and stuff. If it goes away, that's the end of the story. But if it persists, then you probably have to find out what's the underlying cause and then to get rid of it. And also control it in the long term.
Right. Well, I mean, what do we mean by persist, though? Because, like you say, it can happen for so many of us on separate occasions. So if it does happen at one stretch, it doesn't stop after 2 weeks, like you said, that's a cause for concern. Okay. But what about if it happens, like, every other week for somebody? I mean, I know many people who complain about that. If they sleep in air conditioner, they get a nasal congestion. If they go to a new environment, they get a nasal congestion. When it's happening like that, what are the medical options there?
First is most of the time we can give medication. Most likely they are due to allergies. So the allergy medication include tablets. You can give topical nose drops as well. Now the topical nose drops, however, are not a long-term solution. It's a quick fix. You can take it for 5 days, but you have to discard the medication. That's because these medications are, you actually can destroy the nose in the long run.
Right. Well, let's definitely find out more about some of these treatment options.